Hello, Lisa. So
Hi.
you had surgery last week, correct? So you're
Last
about
Monday.
last Monday, so about 7 days out, and you've
Yes.
lost 15 pounds.
Yes.
So I want you to tell them pretty much what that process was like. Kind of walk through the hospital, what it was like the day after surgery. Tell us.
Oh, okay. Okay. I was a little nervous going in, and I'm sure everybody is. But when I got there, they were just so friendly and nice, and tried to make me feel at ease. And I just went in and did my pre-op, and or I guess that's what you call it. You know, they were getting you ready for the surgery and everything. And they, I was just amazed at how friendly they were and tried to keep me calm or whatever. I was
Good.
not the
That's
least
what I
bit.
want.
I was not the least bit nervous. It's like I didn't have time to think about it,
Oh, good.
being nervous, and
How did you feel right after surgery?
I felt great.
How much pain did you have right
I
after
had
surgery?
none.
None.
I
Okay.
mean, they kept asking me, "What's your pain level?" On a scale of 1 to 10, and I just said 1 or 2 because I wasn't feeling any. I didn't.
Right.
I had no pain, no nausea
How soon do you
whatsoever.
think you got up walking after surgery?
Just it was a few hours. I want to say like maybe 4 or 5 hours.
And how did that
After
go? Did you feel pretty strong on your feet?
I did. I
Yeah.
did. They helped me up, and the nurse was so nice, and he kind of held my hand and walked me down the hall, and but I was fine after that, and then I felt like getting up even more, to walk, and so they let me. They were real nice. They came in and would get everything unhooked or hooked or whatever, and I felt great.
So you went home the morning after surgery.
Went home the morning after
How was the trip
surgery.
home? Because it was
Wonderful.
what,
It was
3 hour drive?
right
Okay.
about a 2.5 hour drive, and I didn't have any problems. We stopped about halfway, and I got out of the car and just kind of walked around the car just to so I wouldn't get stiff or anything, and I was very comfortable. No pain whatsoever.
Good.
No
Good.
pain.
So you didn't use pain medicine, but maybe
I
a couple
the
days or so.
the 2 prescriptions that were given to me, here
Hmm.
to get filled before the surgery, I've never opened them.
Oh, really?
Neither one of them.
Well, you
For
did
the
better than most, but
for the
still, people do
nausea
well.
or the pain, I've never used either
Oh,
one of
good.
them.
Good.
Yeah, yeah.
So, what was it like eating through the week? And any struggles or any thoughts or
You know,
anything?
actually, no. I wasn't. Of course, I knew I needed to be on liquids, and so I had prepared ahead of time and had the broth there, and um, I just I was just real careful. I just took baby sips. I didn't try to gulp or do
But you
anything
could feel
like
it when you
that.
took a little extra big gulp.
Yes,
Yeah.
and it wasn't like it was like excruciating pain or anything like that. It was just uncomfortable, and so
Let you know.
I knew, okay, let's
Back off a
off
little
on
bit.
that a little bit.
Yeah.
But I did great. I didn't have any problem getting the water down.
So, what are you eating now? You eating some regular food a little bit.
Well, I've just been some soups, some
Okay.
creamier soups, and
Anything like tuna fish or anything
I
like
haven't
that?
tried that yet.
Okay.
Hmm.
So you're right at that stage actually to start advancing your diet to something that's soft, easy to chew, still going to only take a little bit. So even soup, how much soup fills you up right now?
Oh, God, it is so funny. It's amazing because I open a can, and then I'm used to filling a bowl up, and so I just fill about half a bowl up, and then and I eat slowly, and I try to really taste the food, and and then I always have just a little bit left. So I'm thinking maybe half a cup at the most,
Okay.
maybe, is what I've probably.
So it sounds like everything has gone great. Have there been any struggles? Even the least struggle?
It's hard for me to come up with something. I will say that sleeping at night, I've noticed I've had to be a little more elevated
Okay.
than normal. And of course, I
You
sleep on
can't.
my side, so it's been a little. I'm sleeping on my side now. I'm able to do that, but the first few nights I had to
Okay.
sleep on my
So that's
back.
already improved quite a
Oh
bit.
yeah, yeah,
So a week out, 15 pounds. Can you tell that in any kind of way?
yes.
Clothes or
Just
movement or
well, in
anything?
the top that I put on today, even the last time I wore it, it was kind of snug and tight. And I looked in the mirror when I put it on. I thought, gosh, this looks kind of. It didn't. I mean,
It
it didn't
looks
fit me
good.
the same. It didn't fit me the same. And so, but I can tell. I can, just even in the clothes I run around the house in, I can tell.
Good.
That it's they're just not as tight, you know. Yeah.
Good. So you're going to banter diet over the next month, gradually
Yes.
eating a little more to the point that you should get to eating 4 to 6 ounces of food by the end of the month. And it probably in your case is going to be closer to the 4 ounces, particularly for the first month.
Okay.
So,
Okay.
all right.
Yeah.
Thanks.
Yeah. Thank you. Thank you.